So, white blood cells and clotting for Chapter 13. These are our learning objectives for white blood cells and blood clotting. Leukocytes are white blood cells. So, these white blood cells are characterized by granules, or they may be characterized by the absence of granules. So, granules are considered granulocytes. The absence of granules are considered agranulocytes. So the white blood cell count normally is between 5,000 and 10,000. Leukopenia is anything with a white blood cell count below 5,000. And it may be occurring because of malfunctioning in the blood forming tissue or disease affecting the membranes. So the primary function of white blood cells is protection and immunity. That's very important for you to know. You also need to know what phagocytosis is. So phagocytosis is a condition in which neutrophils and monocytes ingest microbes. So it's like the engulfing of bacteria. So the white blood cells come, totally engulf the bacteria, basically like consuming it. That is called phagocytosis. And the white blood cells responsible for that is neutrophils and monocytes. AIDS stands for Acquired Immune Deficiency Syndrome. And this particular disease is classically characterized by leukopenia, so a low white blood cell count. And leukocytosis is often accompanied by infection. Let's talk about what leukocytosis is. So it is abnormally high white blood cell count. So if you have an infection, the blood is drawn, usually a CBC with diff, a complete blood count CBC with diff, basically just saying we also want to know about the different categories of white blood cells in that particular blood sample. So if the white blood cell count is elevated or above 10,000, then this is considered leukocytosis. Okay? And it's frequently found in bacterial infections. So all the white blood cells rush to the site because of the infection. That's why on a previous slide I said leukocytosis is often accompanied by infection. Okay, this is a classic sign of blood cancer as well, which is called leukemia. So the differential white blood cell count, that's that CBC with diff that I said earlier. The differential blood cell count is with diff. Leukocyte types and functions. So we have granulocytes. So these are the white blood cells with the granules. Our neutrophils, eosinophils, basophils. So all of the phils are granule. All right, so our neutrophils are the most numerous types of phagocytes. We already talked about bacteria. It engulfs the bacteria, so the number increases when you have a bacterial infection. Eosinophils are the weakest or the weak phagocyte. Very active in parasites are parasitic worms, and eosinophils are um, involved in allergic reactions, including asthma. Basophils. Basophils related to mast cells in a tissue, and these mast cells and basophils secrete histamine, which causes inflammation. Basophils also secrete heparin, which is an anticoagulant and prevents clotting. Or your book states that heparin helps prevent the blood clotting as blood flows through the blood vessel of the body. All right, here is a picture of phagocytosis. This picture is on page 371. I would make sure I read through each of these three boxes and understand phagocytosis. I'm certain you'll have a test question on this. Granular leukocytosis. So we have agranulocytes, which are our monocytes and our lymphocytes. So the monocytes in peripheral blood are macrophage, turn into macrophage in the tissue when they grow larger, which is our last bullet on this slide. For our lymphocytes, we have B lymphocytes, which are plasma cells, and then we have T lymphocytes. So for our monocytes, they are the largest leukocyte. They are aggressive phagocytosis cells. They engulf large bacteria as well as cancer cells. They develop into much larger cells called macrophage, which I mentioned earlier, after leaving the blood and entering the tissue. On the previous slide, we talked about the two types of agranulocytes. So that was our monocytes and our lymphocytes. So we talked about the monocytes in depth on the last slide. Now we're going to talk about our lymphocytes. So lymphocytes, we have B lymphocytes. They're involved in immunity against disease by secretion of antibodies. Mature B lymphocytes are called plasma cells. T lymphocytes are involved in direct attack on bacteria or cancer cells, not antibody production. Okay, so that's the difference between our T and our B. Our B secretes the antibodies, and T basically attacks the bacteria or cancer cells. White blood cell conditions. Two types of white blood cell cancers or neoplasms. So we have our lymphoid neoplasm, which results from B and T lymphocyte precursor cells or their descendant cell types. Then we have our myeloid neoplasm, which results from malignant transformation of precursor cells of the granulocytic white blood cells, monocytes, red blood cells, and platelets. Multiple myeloma, cancer of B lymphocytes called plasma cells, most deadly blood cancer in people older than age 65. Causes bone marrow dysfunction and production of defective antibodies. So you want to know these conditions. All right, this picture is showing us multiple myeloma and how on the x-ray it's a honeycombed effect, almost like holes punched out in the bone. Leukemia. Leukemia is white blood cell related blood cancer characterized by marked leukocytosis, identified as acute, which is rapid development of symptoms, chronic, slow development of symptoms, lymphocytic, affects lymphocytes, or myeloid, which affects granular leukocytes as they develop into red bone marrow. So leukocytosis is caused by both infection as well as leukemia. Common types of leukemia. So we have our chronic lymphocytic leukemia or CLL. The average age of onset is 65, rare before age 30, more common in men than women, often diagnosed unexpectedly and routine physical exam with the discovery of marked B lymphocyte or leukocytosis. Generally, mild symptoms include anemia, fatigue, and enlarged, often painless lymph nodes. Most patients live many years following diagnosis, and the treatment of severe cases involve chemotherapy and irradiation, and are more susceptible for this disease. So this picture is showing the lymphocytes or B lymphocytes in chronic lymphocytic leukemia or CLL. Acute lymphocytic leukemia or ALL, primarily a disease of children 3 to 7 years old of age. 80% of the children who develop leukemia have this form of leukemia. Highly curable in children, but less so in adults. Onset is sudden, marked by fever, leukocytosis, bone pain, increase in infection. Lymph node, spleen, and liver enlargement is common. Treatment includes chemotherapy, irradiation, and bone marrow or stem cell transplant. And here's a picture showing us our acute lymphocytic leukemia or ALL. Chronic myeloid leukemia or CML accounts for about 20% of all cases of leukemia, occurs most often in adults 25 to 60 years of age, caused by cancerous transformation of granulocytic precursor cells in the bone marrow. Onset and progression of disease are slow, and symptoms of fatigue, weight loss, and weakness. A bone marrow transplant may cure up to 70% of these cases. Chronic myeloid leukemia or CML continued. So the diagnosis is often discovered as a discovery of marked granulocytic leukocytosis and extreme spleen enlargement. Treatment by newly designed drug, so Gleevec, or bone marrow transplant is a curative in over 70% of the cases, which I mentioned. So here's a picture of chronic myeloid leukemia or CML. Acute myeloid leukemia, AML, accounts for about 80% of all cases of acute leukemia in adults and 20% of acute leukemia in children. Sudden onset and rapid progression. Symptoms include leukocytosis, fatigue, burn, and joint pain, spongy bleeding gums, anemia, and recurring infection. Prognosis is poor, with only about 50% of children and 30% of the adults achieving long-term survival. Bone marrow and stem cell transplant has increased current cure rates in selected patients. Infectious mononucleosis is a non-cancerous white blood cell disorder. Highest incidence is between the age of 15 and 25 of age. Is a virus present in saliva of an infected individual, leukocytosis or atypical lymphocytes with an abundant cytoplasma and large nuclei. Infectious mononucleosis signs and symptoms include fever, fatigue, a sore throat, rash, enlargement of lymph nodes and spleen, generally self-limiting and resolves without complications in about 4 to 6 weeks. Atypical lymphocytes. This is a picture of it. Platelets and blood clotting. Platelets play a role in blood clotting. Blood vessel damage causes platelets to become sticky and form a platelet plug. Accumulated platelets release additional clotting factors that enter into the clotting mechanism. Platelets ultimately become a part of the clot itself. So, what does thrombin combine with to form fibrin? And that's fibrogen. That's the answer. Fibrogen and thrombin combines to form fibrin. When clot form in an unbroken vessel of the heart, brain, lungs, or any other organ, it may shut off the blood supply to that vital organ. So I don't know if you remember, I gave an example of a a brain a stroke. I'm sorry, a clot forming in the brain causing a stroke. Clotting mechanism. Damaged tissue cells release clotting factors leading to formation of prothrombin activator, which combines with platelet producing prothrombin activator. Prothrombin activator and calcium convert prothrombin into thrombin. Thrombin reacts with fibrogen and forms fibrin. This is what I just told you guys, so it's important for you to know that. Thrombin reacts to fibrogen and they form fibrin. Fibrin threads form a tangle to trap red blood cells and other formed elements to produce a blood clot. So sometimes blood clots are essential, right, to save your life and stop bleeding. Other times they can be deadly if in fact it is occluding a vessel and causing blood cells not to flow to a particular area. So a embolism is a clot that has moved from its original location. So it broke off of the original location and now it's floating through the bloodstream. Okay, so a stationary clot is considered a thrombus. I mentioned this in the class yesterday or the other day. So this picture is in your book on page 374 and 375. It is showing you blood clotting. So I would be familiar with this picture and how blood clots and what is required for blood clotting. Altering the blood clotting mechanism. Applications for gauze, so a rough surface, to the wound causes platelet aggregation and release the clotting factor. Administration of vitamin K increases synthesis of prothrombin. Coumadin delays clotting. Coumadin delays clotting by inhibiting prothrombin synthesis. So Coumadin is an anticoagulant, so it delays clotting, anticoagulant, preventing clots by inhibiting prothrombin synthesis. However, the antidote for Coumadin is vitamin K. You may need this for med-surg or pharm next semester. So administration of vitamin K increases the synthesis of prothrombin. Okay. So what might a patient require Coumadin or warfarin to why would they require that to delay clotting? So it could help prevent repeated thrombosis or clots from developing after a heart attack or maybe stroke, right? Or the formation of clots being prevented after surgery, such as our valve surgery, heart valve surgery. Those patients are prone to throwing clots. Also, are patients diagnosed with atrial fibrillation, they're prone to developing clots as well. So sometimes an anticoagulant, such as Coumadin or warfarin, may be ordered to prevent clots. Altering the blood clotting mechanism. So heparin delays clotting by inhibiting conversion of prothrombin to thrombin. Drug called tissue plasmogenic activator, or TPA, is used to dissolve clots that have already formed. So TPA is nicknamed the clot buster. So if in fact the patient meets certain criteria, which you will learn next semester in med-surg, then this is the drug of choice for our stroke patients if they meet certain criteria. So you have to be in a certain at the hospital at the in a specific time frame. In addition to, you must have, there are several different types of strokes, so you have to have a stroke caused by a clot, okay, in order to use TPA. So I do want to mention For anticoagulants, there are labs that are drawn to regulate that. Okay, so our heparin, we use prothrombin time test. Okay, that's our PTT. That's how we regulate our heparin. Okay, especially when you're utilizing IV heparin. All right, very important. For our Coumadin or warfarin, which we talked about on our previous slide, we use the International Normalizing Ratio, or INR. Okay. Now, usually the INR is ordered with something called a PT. So PT INR is a lab test. Okay, that's ordered if someone's taking warfarin or Coumadin, and the INR is the main number that you're paying attention to and you're reporting to the provider in reference to dose changes. So PT stands for prothrombin, and time, prothrombin time is PT, and then for heparin is PTT, prothrombin test. Prothrombin time test used to regulate the dosage of anticoagulant drugs. Calcium and prothrombin, the prothromboplasty added to the tube of the patient's plasma and a tube of controlled solution. Time to see how long clotting takes, and compared to see if the drug dosage needs to be adjusted. So highly variable results include labs that have been used in the INR, or International Normalizing Ratio system, which is a calculation of a standardized measurement. All right, so INR is necessary to help standardize the testing methods and ensure the prevention of unwanted blood coagulation or clotting. Clotting disorders. So we have our thrombus, which is our stationary clot. We have our embolus, which is our circulating blood clot. TPA can be used to dissolve clots that have already formed. So it's a clot busting drug. Here's a picture of pulmonary embolism. So we have a clot that lodged into the lungs. Okay, and so this is a serious condition and could be considered very fatal. So you want to make sure that you're aware of this particular condition. So an embolus, or clot fragment that formed in the leg, broke away and lodged into a branch in the lung. Okay, and I do want to tell you that this can be fatal. Hemophilia, X-linked inherited disorder that results from inability to produce factor VIII, a plasma protein responsible for blood clotting. Most serious bleeding disease worldwide, hemophilia, a most common form, characterized by easy bruising, deep muscle hemorrhage, blood in the urine, and repeated episodes of bleeding into joints causing pain and deformities. Treatment includes administration of factor VIII, injury prevention, and avoiding drugs such as aspirin that can alter clotting mechanisms. So, hemophilia. Thrombocytopenia is caused by reduced platelet count, characterized by bleeding from small blood vessels, most visible in purpura, or purplish spots on the skin and in the mucosa. Platelet count below 20,000 may result in catastrophic bleeding. Normal platelet count is 150 to 400,000. Most common cause is bone marrow destruction by drugs, chemicals, radiation, and disease such as cancer, lupus, and HIV. Treatment may involve transfusion of platelets, corticosteroid type drugs, or removal of the spleen. As long as adults have a healthy gastrointestinal system, there should be enough vitamin K available for clotting. So vitamin K is necessary to make several clotting factors. Vitamin K mostly produced by bacteria in the intestines where it is absorbed into the bloodstream. Infants may lack bacteria to produce enough vitamin K for normal clotting. So vitamin K deficiency is a serious situation because it will affect your clotting. And you need to know this for next semester for sure. I know that some of the second semester students were talking about vitamin K and how it's produced by bacteria. Okay, so there's no questions because we're not in person. However, I'm going to go through my notes and just see if there's anything that I did not emphasize that I really want to emphasize for you guys. Okay, so macrophage literally means large eater. So you want to know that. Macrophage means large eater. Okay. So, multiple myeloma occurs in mature antibody secreting B lymphocytes. The treatment for multiple myeloma may lengthen life and relieve symptoms, but it does not cure the disease. So, multiple myeloma is not, yeah, there is no cure for that. So, cancerous formation of B lymphocytes caused by symptoms of swelling. And this is for our acute lymphocytic leukemia or ALL. Cancerous formation of B lymphocytes cause the symptoms of swelling. So that could be a question where they want to know what's causing the swelling, and that is our um, B lymphocytes. Okay, so the Epstein-Barr virus is found in the saliva of infected individuals with mononucleosis. So you want to know that Epstein-Barr virus, okay? That is what is found in the saliva of people infected with mononucleosis. Short name for it is mono. So some serious complications can come from infectious mononucleosis involving any body part, body organ system can occur in patients with compromised immune systems. So mononucleosis for someone that has immune deficiency can be very serious. Mhm. Clotting can be dangerous if, in fact, it occludes a vessel, right? Or if the clot breaks off and um, lodges into a major organ, damaging tissue. You want to know vitamin K is the antidote for Coumadin or warfarin. Coumadin is the brand name for the drug. Warfarin, um, generic. I believe that is all I have for you.